Welcome. I'm Eva Shaw. I am a special education consultant at the Wisconsin Department of Public Instruction and team. And with me today is Tim Pierenboom. He's the school psychology consultant on the Student Services and Prevention and Wellness team at the Wisconsin Department of Public Instruction. And we are here today to go over the summary of rule change for identifying an emotional behavioral disability. The following slide presentation is the summary of the key changes of the Wisconsin Administrative Rule addressing the identification for emotional behavioral disability. Individualized education program teams will need to use this new criteria to identify an emotional behavioral disability for referrals for special education dated on or after December 1st, 2021. Additional information will be found at the Special Education DPI webpage for emotional behavioral disability.
So to start off, we're going to talk about a little bit of the history of emotional behavioral disability. Historical context is important because obviously with emotional behavioral disability, there's some stigmatizing history of the term. As you can see on the slide, imagine today in 2021, telling the parent of a child on the autism spectrum or inner child that their child is seriously emotionally disturbed. We've come a long way since then, but we certainly have a ways to go. Also in this context is IDEA itself hasn't changed much at all, with the exception of removing the term autism and having it be its own category now, as well as removing the seriously from the emotionally disturbed term. In Wisconsin, it's been 21 years since the last time our PI 11 evaluation process for emotional behavioral disabilities was updated. And the other reason historical context is important and our adjustment to our current rule is because the federal definition of emotional disturbance is ambiguous, and that leads to inconsistency across states and school districts. And now a little more recent history. What you see on your slide here is over the last 10 years, data on risk ratios for the identification of emotional behavioral disability by race. As you can see on the arrow on the left there, a risk ratio of 1.0 would mean in the categories you see on the slide, 1.0 would be identification of emotional behavioral disability is exactly proportionate to the rate percentage of students overall. An identification rate or a risk ratio of 2.0 would mean that students in that category would be twice as likely as the general population to be identified with an emotional behavioral disability. 3.0 students would be 3 times as likely to be identified, and so on. So as you can see, identification rates, if you are Black, Indigenous, or are identified as being part of 2 or more races, you are right around twice as likely currently to be identified with an emotional behavioral disability. I do want to point out that other demographic data that we collect, racial demographic data such as Asian, Hispanic, Hawaiian, Pacific Islander, are not included on this chart because they simply just didn't fit, and the numbers aren't nearly as alarming as the other categories that you see on the chart. If those people who may be interested in that data, we are certainly willing and able to share it. So another important thing to look at here is we do need to think about those other populations you don't see as well as white because they are identified as having risk ratios of under a 1. So this might actually suggest under-identification. And our focus, as you'll hear throughout the remainder of our presentation, what we're looking for is accurate team decisions and accurate determinations. So you may want to think about this as we're sharing some additional data, but think about it in terms of what does your local data tell you? Disproportionality, particularly when it comes to emotional behavioral disability, is not just race. Socioeconomic status, whether a student is male or female, those also have implications and data to suggest that there are other demographic indicators that might lead to over or under identification of emotional behavioral disability. This is just a closer look at disproportionate representation by race within the category of emotional behavioral disability. This is from the 2018-19 school year. What you see here is we would presume that for each racial demographic group that the percentage of students that make up our student population would be roughly the same as the proportion of those populations within students identified as having emotional behavioral disability. But as you can see, this is not the case. White and Hispanic students make up a much lower percentage of identifications, while other racial demographic groups make up higher percentages of identifications of emotional behavioral disability. Finally, this is the 2018-19 data, as I mentioned, but this is not an outlier during this school year. This has remained roughly the same over the past decade. So what's the problem with disproportionality, or more importantly, what's the problem with inaccurate identification? Well, as you can see from this slide, what happens when students are identified with emotional behavioral disability, they get less of the good stuff, such as positive feedback from adults in their school. They receive fewer positive interventions and supports, and they get way more of the bad stuff that happens in schools, such as suspension, expulsion, seclusions and restraints, negative feedback from adults, teasing and bullying from peers. Well, and then not surprisingly, once they leave school or they get further on in their schooling, that they experience way less of the positive secondary and post-secondary outcomes, such as positive or strong academic skills, lower graduation rates, job prospects, college entrance and college completion. And they experience way more of the negative outcomes post-high school, or during high school: dropout, incarceration rates, poor physical and mental health outcomes. So while it's not the only route to those negative outcomes, not being white and being labeled with an emotional behavioral disability is about one of the surest routes through the school to prison pipeline. So we need to be sure that we're making accurate identifications. And once we make those identifications, that we are very intentional about combating the structural disadvantages these students face through the supports and services and specialized instruction provided through a student's individual education plan. And as I've mentioned a couple of times already, it's not just about over-identification or under-identification and disproportionality. The evaluation rule update is about accurate identifications. You can link to information on our comprehensive special education evaluation page, information by Dr. Marquita Newell, who writes in part, "To this end, we must clearly understand the conditions under which the decision to identify a student as having a disability and providing special education services is inappropriate not just for students of color, but for any students." So again, it is about accurate identification of the category criteria and disability-related needs. Given the data just discussed on the previous slides, we want to be very sure that a student needs special education and meets that category criteria, and that they receive the effective services via their IEP that address their disability-related needs.
So as Tim mentioned, Wisconsin's rule change provides a formula for an accurate identification of an emotional behavioral disability through a comprehensive special education evaluation. This Wisconsin rule change, defines the characteristics of an emotional behavioral disability in clearly defined, observable, and measurable terms. It requires objective assessments and data, which allows teams to focus on the student's strengths and disability-related needs and limits subjectivity and potential bias. The result of objectively measured observable characteristics should be an IEP team with the ability to accurately identify whether or not a student has an emotional behavioral disability, with strategies and systems in place to address the impact of implicit or explicit bias. It will increase consistency in evaluation procedures across schools and LEAs and in conducting a culturally competent evaluation. It will assist IEP teams to be objective when identifying the disability category of emotional behavioral disability and determining eligibility for special education services. There are 4 sections of the new rule, and they are the definition, characteristics, the required assessments, and additional requirements. And we're going to go over those now. So the definition was revised and condensed for improved clarity. And the revised definition reads, emotional behavioral disability means a condition in which a child demonstrates frequent and intense observable behaviors, either over a long period of time or of sudden onset due to an emerging mental health condition, which includes a diagnosis by a licensed mental health professional, which adversely affects the child's educational performance. The behaviors shall occur in an academic setting in school, in a non-academic setting in school, and in the child's home or community. As you'll notice from the old definition, academic progress, social relationships, personal adjustment, classroom adjustment, self-care, and vocational skills were replaced with educational performance. Like I just mentioned, the specific areas that were removed from this paragraph are now addressed more objectively in the characteristics section B, which defines each characteristic. Severe and chronic were reworded in the definition to intense and a long period of time, which more closely aligns to IDEA definition. And there is also the added consideration of sudden onset due to an emerging mental health condition to allow for circumstances when there may be a high frequency or intensity of observable behaviors or over a shorter period of time or multiple acute episodes. A diagnosis of a mental health condition by a licensed mental health professional is not required if the condition of long period of time has been met, nor is a diagnosis by a licensed mental health professional sufficient evidence of an emotional behavioral disability. If the student has a diagnosis by a licensed mental health professional, the IEP team will document and consider the diagnosis while conducting the requirements in paragraph C to investigate whether the symptoms of the diagnosis are evident at school and adversely affect the student's educational performance. The new rule also makes explicit that behaviors occur in both academic and non-academic settings in school. The behaviors are still required to occur in school and in the home or community. Now we're going to look at each individual characteristic in section B of the rule. So the IEP teams must document that the child exhibits one or more of the characteristics through the added requirement of specific data sources and assessment practices found in paragraph C. The IEP team may identify a child as having an emotional behavioral disability under paragraph A if the child exhibits at least one of the following. Characteristic 1 states behaviors that interfere with the development and maintenance of age and grade appropriate interpersonal relationships. You'll notice that we removed the deficit-based language of inability, which presumes or infers an unfixable problem, and replaced it with behaviors that interfere to focus assessments on barriers to relationship development. We also removed satisfactory from the language to make it less ambiguous and subjective, and replaced it with more objective age and grade expectations to reduce the impact of implicit or explicit bias in identification of an emotional behavioral disability. Characteristic 2 states observable affective or behavioral responses during routine daily activities inconsistent with the norms of the child or the child's community. Again, we remove subjective and ambiguous language, such as inappropriate and normal, and replaced with observable, ensuring measurable behaviors are considered to enable more objective assessments when identifying an emotional behavioral disability. Also added was additional language to ensure consideration of the norms of the child and the child's community, including cultural and ethnic norms, and how they interact with the norms and culture of the school and the classroom. Characteristic 3 is unchanged and still remains pervasive unhappiness, depression, or anxiety. Characteristic 4 is largely the same and reads physical symptoms or fears associated with personal or school problems. The word pains was removed as pains fall under the category of physical symptoms. Characteristic 5 reads insufficient progress toward meeting age or grade level academic standards that cannot be explained by intellectual, sensory, or health factors. Again, we remove deficit-based language, inability to learn, which infers an unfixable problem. The language change is designed to focus assessment on barriers to academic progress that may be present within the instruction, curriculum, and educational environment. We added language to require measuring progress toward academic standards as a more objective and observable characteristic. We maintain the specificity of intellectual, sensory, or health factors, which aligns with IDEA definition, and to ensure IEP teams consider these factors as part of a comprehensive special education evaluation. Characteristic 6 reads, isolation from peers or avoidance of social interactions impacting the child's access and engagement in instructional activities. The word extreme was removed to make the language less ambiguous and subjective, and we replaced withdrawal from social interactions to more clearly define observable behaviors, ensuring measurable behaviors are considered to enable more objective assessments when identifying an emotional behavioral disability. We added language to focus assessments on the impact of isolation and avoidance as a barrier to the student's access and engagement in instructional activities, and the adverse effect on the student's learning, academic achievement, or functional performance. And the last characteristic is characteristic 7, patterns of behaviors across settings and individuals presenting risks to the physical safety of the child or others. Again, the word extreme was removed to make the language less ambiguous and subjective. We replaced aggressiveness with observable, measurable language to encourage more objective evaluations when making decisions on disability identification. And we included patterns of behavior across settings and individuals to limit impact of potential implicit or explicit bias by an individual or individuals on the IEP team, as well as to establish that the behavior is not in response to a specific setting, individual, or relationship. This objective assessment and analysis of patterns are vital in order to reduce extreme racial disproportionality in the identification of emotional behavioral disability between racial and ethnic groups in Wisconsin.
Now I'm going to go through the next section of the rule, the required data and information sources that are required for IEP teams to collect and use in the determination of emotional behavioral disability. The language you see on the slide was removed due to the ambiguity and high potential for implicit or explicit bias, stereotypes, or cultural differences, resulting in inappropriate identification and disproportionate representation of racial and ethnic groups. So instead, we broke the vague and ambiguous previous language into specific components of a comprehensive special education evaluation that must be included if emotional behavioral disability is being considered. This is to enable more objective decisions, to limit the use of subjective information, to minimize the impact of implicit and explicit bias on team decisions, and reduce ambiguity to assist IEP teams in identifying the objective disability criteria of emotional behavioral disability. Required data sources and assessment activities ensure teams have enough objective data to determine if the student meets criteria for an emotional behavioral disability and to identify the disability-related needs in order to develop a student's IEP. Ensuring multiple specific data sources and data collection methods provides IEP teams with the ability to determine whether the preponderance of evidence documents and supports the identification of an emotional behavioral disability. This is an important factor, again, in reducing the racial disproportionality in emotional behavioral disability identifications. That is to say, teams aren't just looking for a score or scores from standardized behavior checklists, but they are looking at the whole child. Finally, the requirements that we are about to go over were included because they better align with current trauma-sensitive, mental health, positive behavior intervention, and support best practices. First requirement you see on the slide here is providing, monitoring, and documenting evidence-based positive behavior interventions and monitoring progress for a student suspected of having an emotional behavioral disability. This provides the IEP team with information and data that are critical for determining whether or not a student has an emotional behavioral disability and to identify the student's unique needs. Required observations across settings to take into consideration the impact of the instruction, curriculum, environment, student relationships, adult relationships, and other factors that impact a student's behavior. Observations across settings identify functions and patterns of behavior when considering where and under what conditions behaviors do and do not occur. Again, very important information for a team to consider when determining the cause of a student's behavior. Additional requirements including interviews of the child and the parent or family that includes gathering information regarding information about the child's family's norms and values, as well as other ecological factors that might impact the child's behavior. Interviews with teachers that include gathering information regarding the child's strengths and ecological factors in school that may be impacting the child's behavior. You'll see here that the norms, values, ecological factors are included for very important reasons. We know that behaviors don't occur in a vacuum, that they occur, that the child's behaviors influence what goes on around them, and the things that go around a child influence their behaviors. So these required interviews with multiple individuals allow for direct input from the student and family, and the consideration of ethnic and cultural norms of the student and their family, the norms and culture of the school where the student is attending, and how those things all interact together, which is sort of encompassed in that term ecological factors. Interviewing an LEA staff member or a school staff member that is identified by the child when possible that has a positive or the most positive relationship with that child. This includes gathering information about the child's strengths, ecological factors that impact the child's behavior. This subdivision, this particular inclusion as a requirement doesn't apply if that particular staff member, ideally chosen by the child, was already interviewed under the requirement number 4. We felt this is important because this is a trauma-sensitive practice. This is a school-based mental health best practice that identifying and understanding a student's strengths, allowing a student some agency and some choice in who is included in their IEP team or their evaluation team, particularly when you're looking at a student who is being considered for emotional behavioral disability, is that having someone on the team who has a positive relationship with that student, again, is a trauma-sensitive practice. It is a mental health best practice. It is an important factor when a team is considering emotional behavioral disability. Another required area of information to be gathered is a review of educational information, including the student's health history, academic history, disciplinary records. Again, this is a PBIS best practice that we're looking at those ecological factors and other things that might influence a child's behavior. When it comes to standardized rating scales, we neither want to overemphasize the results of those rating scales or underutilize those. So it is a requirement to utilize the results and collect results of standardized behavior rating scales that are normed on a nationally representative sample of students from a minimum of 2 sources. 2 sources from school and 1 source from the home or community. So the home or community could be a parent, a grandparent, a community member who might be a mentor, or a student who might be involved in a club or a different organization, an adult from that who knows the student well. Obviously from school, we're looking for 2 sources of school staff members who know the student well. We do have some language in here that suggests that if there are not two adults in a school who know the student well enough to gain valid and reliable results on that particular scale as defined by the publisher. So most rating scales will have recommendations and guidelines for how well an adult needs to know a student before rating them and how long they need to know them. If there are not two adults available for that, then there is a caveat that that is okay, but it needs to be documented in the evaluation report. Ideally, the rating scale that is used is nationally normed, and that rating scale ideally will include normative data that reflects the child's background, whether that's their racial and ethnic background, their socioeconomic background, and things like that. So if the child's background is not included in the normative data of a standardized rating scale, then the evaluation report needs to document that and include an explanation. So it's going to need to be understood that if the scale doesn't include an accurate representation of the student, that the team documents that and discusses how that might have impacted the rating scale results. We removed the subjective and deficit-based language that you see on the slide here. Social maladjustment was removed as there is no clear definition of it in IDEA, and therefore it makes it difficult to differentiate between social maladjustment and emotional behavioral disability. This can lead to inconsistency in the identification of emotional behavioral disability, whereas we want the primary focus to be on whether a student demonstrates frequent and intense observable behaviors, either over a long period of time or due to the sudden onset of an emerging mental health condition that adversely affects the student's educational performance. We added language for some additional requirements that recognizes that a trauma history or a mental health disorder does not necessitate a special education services, nor does it preclude a student from being eligible for special education services. Determining the impact of trauma or mental health disorder on a student's ability to access, engage, and make progress within the general education setting is one of the tasks of the IEP team as they examine the potential identification of an emotional behavioral disability. Another additional requirement, this was not applicable in the previous rule. We added a consideration of the norms of the student's family and community, which include cultural and ethnic norms, so that IEP teams can take into account the important influence of race, gender, sexual orientation, socioeconomic status, and other factors on a student's behavioral response. This requirement recognizes the importance of the student's real-world experiences, their culture, their ethnic background, and the cultural and ethnic influences on their behavior and development. IEP teams are required to determine if the student's behavioral response is due to an emotional behavioral disability or if it is primarily due to a mismatch between the aspects of the student's home culture and the school culture. This requirement in the rule is explicitly included to address the extreme racial disproportionality in emotional behavioral disability identification in Wisconsin. IEP teams must consider, discuss, and document the consensus determination that the behavioral characteristics identified in Part B of the rule are due to an emotional behavioral disability and not the student or their family's cultural background, implicit or explicit biases within the culture and climate of the school environment, or institutional racism embedded in the school or district policies and procedures. Again, we added the inclusion not only to interview a school staff member who has a positive relationship with the student, but also that there's an individual included on the IEP team, ideally chosen by the student, that would provide that adult perspective on the student's strengths and assets, as well as reduce or eliminate the potential impact of implicit or explicit bias and reporter bias of other individual members of the IEP team or those who may have provided data, input, or information as part of the evaluation. This provides an opportunity for student voice and choice when making identifications whenever possible. So this is another area. This hits on sort of all the best practices that we would want when it comes to trauma-sensitive schools best practice, when it comes to supporting student mental health and wellness, and supporting student resilience. So finally, we turn to where we started and introduced. Again, our goal with updating this rule and making these rule changes is to provide a formula for accurate identification of emotional behavioral disability through a comprehensive special education evaluation. Wisconsin's rule defines the characteristics of emotional behavioral disability in clearly defined, observable, and measurable terms. It requires objective assessments and data which allows teams to focus on student strengths and their disability-related needs. It limits subjectivity and potential bias. The results of objectively measured and observable characteristics should allow the IEP team the ability to accurately identify whether or not a student has an emotional behavioral disability and provide them with strategies and systems to be in place to address the impact of implicit or explicit bias. This will increase consistency in the evaluation procedures across schools and across districts in the state, and includes conducting culturally competent evaluations. It will assist IEP teams to be objective when identifying the disability criteria for emotional behavioral disability and determining disability-related needs. In summary, again, when considering whether or not a student may have an emotional behavioral disability, this happens within the context of a comprehensive special education evaluation. A comprehensive special education evaluation is twofold. That the team is required to determine whether or not the child has a disability, and that their evaluation is comprehensive enough and sufficient to identify disability-related needs and the impact of that disability on their progress in the general education curriculum or age-appropriate activities. Thank you for your time. If you have any questions, you can feel free to contact me, Tim Pierenboom, school psychology consultant at the Wisconsin Department of Public Instruction, or Eva Shaw, special education consultant at the Wisconsin Department of Public Instruction.